understanding from Mark is like you wanted to get a sense, after having spoken about this with the finance
Yeah,
committee,
yeah.
to get a sense from the full council, just going back to the larger targets of this about $90 average increase per household, 2.3% increase. Are people comfortable with that? Should there be stricter targets?
At least for the, let's make it easier, we'll start easier. 1, for introduction. And then there may be.
I mean, I don't see why we're not going, Mike, the only person who, I mean, why aren't we trying to be as tight and as efficient as possible? And go, you
Okay,
know.
so one of that debt service reserve is about $700,000. So tell me where you'd want to find $700,000 in our budget.
Well, that's what I thought we were talking about. I just said the police, and I have a couple other things.
Well, we do
I
have,
understand.
I mean, I would say, like, police are one of the only departments that actually are proposing things.
I know. So that's
Other
why, I mean,
departments aren't, yeah.
I mean, for instance, I've been wondering about the health department. I'm sorry that they're always your departments that are.
I know, what is that about?
Where, do you bump up that?
It's just, and it probably is because I'm not, you know, I'm not as,
Right.
so looking from the outside in, it seems like the hospital moved in 2012, and so why didn't we reduce, you know, not by firing anyone, I never want to do that, but why didn't we reduce the department? And another.
I think they did. They did have 2 full-time registrars, and they knocked it down to 1.5 registrars.
And the other thing is, like, we do have this opportunity right now with Jeff. I mean, I don't want to hijack this conversation.
No,
but-
and we are pursuing the opportunity with Jeff. I totally agree with you. Like, I saw recently that Corner House hired an office administrator, and I said, why are they hiring an office administrator from outside when maybe there's somebody inside where we're trying to reduce administrative
Yeah.
shift it, right?
Yeah.
And so those kind of things. But I mean, look, we did find that with Access Princeton coming over to the clerk's office.
Yeah, that's
what's
great.
happening. That's, you know.
But so, because I just know, and I'm sure it's a completely different.
We are gonna
town,
save on
but
Jeff's move. You're gonna hear about that, yeah.
But Ewing, for instance, and I could be wrong about this, but I was just looking at their budget, I mean, for some crazy reason, but they have 35,000 population, and they have a half-time health officer. So I just, you know.
They don't
Okay,
have Princeton
Steve.
University though. I mean, Princeton University brings a lot of our disease caseload. Where
Yeah, I
we
mean-
see 4 times as many diseases every year than Ewing does, just by Princeton University.
People traveling all over the world bringing Ebola and meningitis, you know, all those things
Yeah.
coming back, right?
Yeah.
No one's seen what he's seen in.
And do
10
they
years.
have restaurant inspections like we have?
Yeah, we also-
They have the College of New Jersey, they have,
We have
It's
more
not
restaurants.
international though.
Yeah, we
No,
have
I know, but I
probably
mean, they
double
have a
the
lot
amount of
more.
restaurants that they do.
Yeah,
they have a
we
lot
twice
more.
as many restaurants at least, yeah.
They have a lot of businesses. Okay, I just, you know, throwing it out
No,
there.
these are good questions, and I
Yeah.
think,
Because right now would be the time to do it, you know, to.
Yeah, well, this,
No, I agree, and I
And
think
even also, you
Looking
can
at
measure
our-
the county too, is some towns don't have their own, is that my understanding?
yeah, so you could consolidate, absolutely.
Yeah. I mean, in Mercer County alone, Mercer County Division of Public Health, their health officer, that's who you're speaking about, is the Ewing health officer part-time. But in looking at our own operations, that's something that I've brought up to administration that I think will hopefully be brought up soon regarding trying to still operate the way we are with a little more oversight from individuals within the department and still utilizing the license that I have. There's your part-time health officer.
We've been talking about that, so we think there's a way
Oh.
that Jeff
Quite
would like to.
frankly,
Oh,
on Thursday, we're gonna be taking that to personnel. So, those are things that we are thinking about
Okay.
that aren't in this budget, but, and that's the reason I said this is not the end of the process.
So I feel like it is happening. I do have to say, I feel like it doesn't happen in all departments.
Right.
I mean, you know, this gives you a sense. We've been seriously thinking about this,
Yeah.
at least in these areas. And I don't know. I mean, maybe it
Yeah.
is, but it's some departments have grown since consolidation and
Yeah.
have not.
Heather, in
Well, we're-
defense of public works, we added services.
Well, then,
We
but that's
extended leaf and brush
but
pickup to
that's what we need to call out, Jenny. We have
Yes.
expanded services.
That's
so you're
right.
saying, why aren't we saving? Well, how can we save when we're expanding services to the public?
Right.
Well, I think, and that's maybe a way to think about this, is
Yeah.
what are the services
then you want to.
that we're willing to say it's more important to give back to taxpayers than to provide them?
Yeah, I think that's.
And
I
we
mean,
talked-
I don't really know.
And
I
we
just-
talked to Bob about the problem is even if you cut back on those services, you don't save automatically
Yeah.
and full FTEs. It
Yeah.
just doesn't correlate the
Yeah.
same way.
And I mean, I completely recognize that you guys have been having these discussions all the
Yeah.
time, so I don't, you know.
One of the things that we try to do, and just to kind of get into the second piece of this, when they met with the departments, and we've been working in terms of departments to put together, and that's what they review with them, program inventories, where we kind of listed out, what are all the programs? The bottom line is, the budget provides services. And if we're gonna make significant impacts on the budget, it's going to be, we're gonna have to deal with, you know, what services are we not gonna provide any longer?
Well,
We
that's
can
what-
always do efficiencies
Right.
throughout, you know, when we continue to do that part of it. But one of the key pieces are, you know, are we willing to reduce some of the services? And I think that's the process that the finance committee went through in looking at the major departments, and we went through, what are the services that you're providing? Are there ways we can better provide those services? Can we eliminate those services? And one of the things that I think the finance committee realized is there's no quick, easy answer to that. There's some long-term things that we can look at. We identified a number of those that I think are, quite frankly, significant. And that's how we should kind of deal with this process. They're not gonna be answers that will necessarily impact this year's budget, but they will be long-term because there are big issues in terms of service delivery.
And they are policy issues.
And there are policy issues. So one of the things the finance committee brought the departments, public works, police, engineering, and recreation, and went through that program inventory with them and said, you know, where could you find some changes? And basically, I think they came to the conclusion that, look, it's gonna be difficult, and I'll use police as an example. If you wanna make some reductions in police, then they've gotta go to their core services, which is patrol. That means traffic's not gonna, you're not gonna be able to staff traffic or SNOOP. And then we have to ask ourselves, are there those programs that the citizens want and expect? And if they are, then, you know, we need to say that they are, and maybe part of this process should be, we should be letting citizens know, this is why, these are the services that we're providing you, and why it costs what it does.
And same with public works, the
Same
same
with
thing,
public
that we're
works.
getting great service,
Yeah.
but it comes at a cost.
But so, just going back to the birth certificate, did you look at whoever's doing the birth certificates for the hospital? I mean, doesn't it make sense to have one place where people look for their birth certificate instead of two? Like right now, they're before 2012, they come here, and after 2012, they go
Plainsboro.
to Plainsboro. I mean,
We still administer copies of birth certificates.
I
for
understand
business
that.
stuff.
I saw you were doing that form, you know. in the
Yeah,
IT.
so we're working on
And I-
seamless,
but
trying to get that
could you-
electronic. We also did the marriage certificates, people still get married here, and
Yeah.
unfortunately, people still die here, so we did the death certificates.
Oh, so if somebody dies here, we do a death
Yes.
certificate?
Yeah.
So, because I remember, we wanted to do the birth certificates for the hospital, and they said no, Plainsboro said no, when we were consolidating, because we were gonna charge them, and it would be,
When the hospital was.
when the hospital moved.
Okay.
I didn't mean, sorry.
Right, because it's a revenue source.
It's a revenue source.
We lost the revenue.
So could we, do the, outsource that and save money? Did you look at that, like to the place that's to Plainsboro, or is it just that? it's-
Well, you would still have to, because we still have, through Homeland Security, we still have to hold those birth certificates, death certificates, and there's licenses here.
Oh.
So somebody would still have to do it, whether it was a clerk that has a registrar.
Custodian, there's
Yeah,
state
so
law.
we have to
Oh, they
register.
can't move them, we
There's
can't.
state
move them.
law
No,
requirements
in
that.
some towns, even an administrator is a registered, a registrar of vital statistics, and they do it. But those are the smaller towns that don't have maybe as many people. But you have to have a registrar, now it's after 9/11, that's a Homeland Security law, that has to have direct oversight. I can't even go into where they're all locked, unless you can, or you can.
And the other issue is, one of the things that's changed since the hospital move in terms of what the registrar does. It's not just register, that's just, to me, that's one of her duties. And really what she provides is more administrative support. And there's been a lot of changes in terms of the level of service that we're providing in the health department. And they needed that administrative support to continue that process.
Yeah, our registrar acts more as an office coordinator,
She's
assistant.
the person who like staffs the desk if you go in.
In charge.
She provides office coverage, answers phones.
And we couldn't combine that. I mean, I'm just throwing this out there, we
Well,
could
she's-
combine that with the clerk's office, right?
Well, you'd have to have somebody in the office, right? I mean, because she answers our health phones.
That's the different physical.
She distributes
issue. Yeah.
the certificates.
know.
She also does all of our restaurant licensing. She kind of operates as the administrative assistant for both inspectors in town. She also handles all the phone calls for the public health nurse, our contractual public health nurse. And so from my end, you know, she's kind of our lifeline in terms of the hub for the office, as most offices have, I'm sure. She's the face you see, you know, when you go to the department to get what you need. And she only has a part-timer behind her kind of filling in for her vacations and sick days and lunch hours, so.
She doesn't make that much though.
Laura Lynn, no, she's been here a long time.
Yeah, she's
Well,
make that.
I want to
Okay,
sort of,
thank you, I really, you know, I'm glad to get this information.
Well, I want to refocus us too, but I want to go back to that question because I feel like it was sort of hanging out there in terms of introduction. Are people comfortable with this amount for introduction at this point? Or should we put that on pause and come back to that question at the end? I want to make sure we have time to go through more of the long term.
I mean, we've been teased with a couple of
Yes.
things about PD, so can we hear those first and then?
Yeah, so why don't we come back to that at the end? And then I think it's important to go through more of a structured conversation about some of the long-term issues because we want to make sustainable, if we're going to make cuts, let's make them sustainable cuts.
And I don't know if this has an impact on this budget, but we have to realize that the town is growing too. So the population is going to go, who knows at the next census what the population is going to be. So as we weigh cutbacks in services, realize that we're going to be serving more people at the same time.
Same, I mean, by the same token, continuing services is going to be increasingly expensive.
Exactly.
The same level.
Although hopefully we get more taxes. with
More
it.
taxes.
Yeah.
So let me go through the issues that the Finance Committee came up with. One of the things that we need to look at is in January of 2018, the organics program contract will be expiring. This is an opportunity to look at that program. It is now costing the municipality money for that program, and that's one I know the Public Works Committee is already taking a look at. So that's one area in which we want to look at in terms of long-term,
That's about 60 grand.
60
Yeah, we
grand.
should be specific. I mean, the point would be to charge people, it's like, I hate it, but it's, the point would be to
I
charge
do.
people the full cost, so that's a
Yes.
very concrete thing.
Yeah, yeah,
Or
I definitely think we need to.
Or, right, exactly.
Yeah.
Either eliminate it or charge the people who participate the full cost.
We did it in the hopes that there would be a facility closer. That has not materialized. We don't see it for the foreseeable future.
Right.
Would people be willing to
We're
pay
kind of
for it?
kidding ourselves.
That's our fear is that
Would they be
people would
willing
not.
to pay for it? Would people be willing to pay the full?
Well, are we
It's
gonna
been-
talk about that right now?
Well, let's go,
What-
do you want to go through?
Yeah, I'm gonna go through all of it.